Because some people spend so much time working at a desk, adjusting the chair and the workstation equipment to suit you and your needs is essential to reducing any pain and stiffness. This is actually a really large subject, which is why I've created some supportive guides to go with this section of the video. Go to our website and you will find guides which go into further depth on the correct sitting posture for working at a desk and how to choose an office chair. As more jobs become desk-based or sedentary, more and more people are spending longer periods of time sitting in chairs. Sitting for 5 hours a day, 5 days a week equates to 1,175 hours, or almost 50 days every year. Multiply that by the number of years at work, add to that the time you are seated at home, and more people spend more time sitting than in bed. According to the ergonomics team at Cornell University, sitting for more than 20 minutes has a negative effect on your body, including increasing the risk of pain and stiffness occurring in the back and neck. They recommend moving regularly to avoid these negative effects, using the principle of 20-20. 20 seconds away from the sitting position every 20 minutes. In other words, you should always try to stand, move every 20 minutes. The correct sitting position and height adjustment of your chair or desk is key. If the height of your desk can be adjusted, you should first adjust the height of your chair so that your feet are on the ground, then adjust the desk so your arms are in the correct position. If the height of your desk cannot be adjusted, you should adjust your chair to make sure your arms are in the correct position. This compromise can mean the position of your legs is not perfect, but it is the lesser of two evils. The best sitting position is achieved by keeping the spine in what is known as a neutral position, whilst positioning your legs so your feet are flat on the floor, with feet and knees roughly hip width apart and maintaining correct arm posture. On a normal office chair, adjust the seat height so your feet are flat on the floor or a footrest if you require one. Your feet and knees should be roughly hip width apart. To set the lower part of the spine in a neutral position, sit on your chair and put your hands on your hips. Now rotate your hips as far forward as you can, then rotate the pelvis backwards as far as you can. You need to find the middle position, so it's best to try it a few times until you get a good feel for where the middle is. The middle posture has been shown to be better than the backwards one, and slightly forwards of the middle posture is actually the best position for your back. However, this puts a lot of pressure on the muscles around the pelvis and can be difficult to hold, so forward tilted chair seats can help. The best angle for your legs is 20 to 30 degrees forward and down. This slightly down thigh posture with the pelvic tilt can take the stress off the joints in the lower back to keep it healthy and prevent injury, whilst also easing ongoing back problems. Sitting correctly and protecting your lumbar spine can lead to improvements throughout the whole of your spine and improve your neck and head position too. Once the pelvis is in the correct position, the ribcage needs to be placed in a straight line over the pelvis. This straight line makes lumbar spine curve inwards. So to complete the full correct sitting posture, try sitting upright without your back touching the chair back. Now imagine a piece of string is pulling your chest upwards towards the ceiling. Raise up slightly from the chest, but do not let your lower back arch more. Once your chest is over your pelvis, the next step is to position your shoulder blades so that the shoulder joints are in line with the body. Most people round their shoulders, leaving them with a posture like this. To put the shoulders to the neutral position, start by pulling your shoulders all the way up. Shrug your shoulders. Then pull the shoulders backwards from this position. Then pull the shoulders down from this position. Now relax the shoulders forwards to the mid position where your hand would naturally fall in line with the middle of the pelvis. The next step is to set the position of the neck. Most people sit with their head forwards. This type of posture puts pressure on the lower neck as it is forced into flexion, as if looking down, whilst the upper part of the neck is forced into extension, as if looking up. Bring your neck back into a neutral position is a simple process, as long as the rest of your posture is already correct. Whilst looking straight ahead, tuck your chin back as if you are holding a small ball under your chin. Your earlobe should now fall within the triangle made up by your collarbone and neck muscles. You might find the position hard to hold at first. In fact, most people can't hold the position for longer than 5 minutes initially. Try the position and gradually increase the hold time until you can hold the position for 20 minutes. Go to our website for more in-depth guides on how to choose and set up a chair, to answer questions like, what type of chair should I use? And is a standing desk a good idea? Or for help on how to set up your desk differently for desktop, laptop and tablet computers. Remember the 20-20 rule, 20 minutes sitting down with a 20-second break moving around. Here are a few simple movements you can use throughout the day when you start to get a little muscle stiffness. For more videos and guides on stretches and simple exercise movements, visit our website at physiomed.co.uk and navigate to our health and well-being section. So, just a few simple movements throughout the day will help to keep your aches and pains at bay. Remember, we all have different requirements and levels of ability, so if you're unsure about any of the exercise you've seen, please consult your GP or physiotherapist initially. We hope you enjoyed the information we have provided. If you would like to know more about Physiomed, visit our website at physiomed.co.uk. Thank you for watching.